Atorvastatin 20 mg per 5 ml, 4 mg per milliliter, oral suspension is used to help lower bad cholesterol and fats and raise good cholesterol in the blood. It belongs to a group of drugs known as statins, and works by reducing the amount of cholesterol made by the liver. Lowering bad cholesterol and triglycerides and raising good cholesterol decreases the risk of heart disease and helps prevent strokes and heart attacks. In addition to eating a proper diet, other lifestyle changes that may help this medication work better include exercising, losing weight if overweight, and stopping smoking. It is important to consult your doctor for more details. The daily dosage and optimal timing for taking this medication should also be discussed with your healthcare provider. When taking atorvastatin, it's important to follow the instructions provided by your doctor or pharmacist. Typically, you'll take this medication by mouth once daily on an empty stomach, either 1 hour before or 2 hours after a meal. The dosage will depend on your medical condition, response to treatment, age, and other medications you may be taking. Remember to shake the bottle well before each dose and use a special measuring device to ensure you're getting the correct dose. It's also important to avoid consuming grapefruit or grapefruit juice while using this medication, unless otherwise instructed by your doctor or pharmacist. If you're taking other drugs to lower your cholesterol, make sure to take atorvastatin at least 1 hour before or 4 hours after taking these medications to prevent any potential reactions. Taking this medication regularly and at the same time each day will help you get the most benefit from it. Even if you start feeling better, it's crucial to continue taking atorvastatin as prescribed. Be sure to also follow your doctor's advice regarding diet and exercise, as it may take up to 4 weeks to experience the full benefit of this drug. This medication has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. Most people who take this medication do not experience serious side effects. A small number of people taking atorvastatin may experience mild memory problems or confusion. If you notice these effects, talk to your doctor. In rare cases, statins may cause or worsen diabetes. Discuss the benefits and risks with your doctor. There is a rare chance that this drug may cause muscle problems, which can lead to serious conditions such as rhabdomyolysis and autoimmune myopathy. If you experience muscle pain, tenderness, weakness, signs of kidney problems, or symptoms of liver problems, inform your doctor immediately. Although very rare, a serious allergic reaction to this drug may occur. Seek immediate medical help if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice other effects, contact your doctor or pharmacist. If you experience any side effects, contact your doctor for medical advice. You may also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. It's important to talk to your doctor or pharmacist before taking atorvastatin if you have any allergies or if you have a history of liver or kidney disease. It's also important to let your doctor or dentist know about all the medications and herbal products you use before having surgery. If you drink alcohol, it's best to limit your intake while using atorvastatin, as it may increase your risk for liver problems. Older adults may be more sensitive to the side effects of this medication, especially muscle problems. If you are pregnant, only use this medication if clearly needed, as it may harm an unborn baby. It's also unclear if atorvastatin passes into breast milk, so it's important to consult your doctor before breastfeeding while using this medication. It's important to be aware of any potential drug interactions that may affect how atorvastatin 20 mg per 5 ml, 4 mg per milliliter, oral suspension works or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Always consult your doctor before starting, stopping, or changing the dosage of any medicines. Some products that may interact with atorvastatin 20 mg per 5 ml, 4 mg per milliliter, oral suspension include daptomycin and gemfibrozil. Additionally, other medications can affect the removal of atorvastatin from your body, which may impact how it works. Examples of these medications include glecaprevir plus pibrentasvir, telithromycin, among others. It's also important to note that you should not take any red yeast rice products while you are taking atorvastatin, as some red yeast rice products may also contain a statin called levastatin. Taking atorvastatin and red yeast rice products together can increase your risk of serious muscle and liver problems. Always be cautious and consult your healthcare provider before taking any new medications with atorvastatin 20 mg per 5 ml, 4 mg per milliliter, oral suspension. If someone takes too much of this medication and has severe symptoms such as passing out or difficulty breathing, it is important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center for assistance. It is important not to share this medication with others. Make sure to regularly undergo lab and/or medical tests while taking this medication, such as blood cholesterol/triglyceride levels and liver function tests. It is important to keep all medical and lab appointments. Consult your doctor for more details. If you forget to take a dose, take it as soon as you remember unless it's been more than 12 hours since your last dose. In that case, just wait until your next scheduled dose. Don't take extra to make up for the missed dose. Remember to take your next dose at the usual time. When it comes to storing atorvastatin 20 mg per 5 ml, 4 mg per milliliter, oral suspension, it's important to keep it at room temperature, away from light and moisture. Don't store it in the bathroom, and make sure to keep the suspension form in its original container. After opening the bottle, make sure to discard the suspension form after 60 days, even if there is still medication left. Also, be sure to keep all medications away from children and pets. When it comes to getting rid of this product, don't flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or no longer needed. If you're unsure about the best way to dispose of it, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.